Because if there's an 80% chance this is going to decrease your pain, like over the next 3 months, even by 10%, 20%, 30%, 50%, is it worth it? Is it worth it? Because I have individuals who say to me, I've tried everything. No, you haven't. You're convinced that you've tried everything. Your doctors are convinced that they've tried everything, but no, you haven't.
Hello and welcome to Awake at the Wheel. So in today's episode, we are welcoming back Dr. Maggie Yu. So we had Maggie on previously a few months ago, and we have welcomed her back today to have a chat about chronic pain. So Dr. Maggie Yu is a family practice and certified functional medicine physician. She graduated from UCLA School of Medicine and has been practicing for over 25 years. So welcome back, Maggie.
Thank you. I'm glad to be back. And I think we're almost at 27 or 28 years.
Awesome. All right. Well, chronic pain is something that is important to us in our work, insofar as we see a lot of individuals who have been injured in motor vehicle accidents, who've been injured in workplace accidents, and it ties in very closely with their psychological functioning. Specifically, we see a lot of individuals who've developed somatic symptom disorder, where their chronic pain has that direct interrelationship with their psychological well-being. So for our listeners, essentially what that is as one's physical pain increases, so does their psychological distress. And as their psychological distress increases, so does their physical pain. So it's a vicious cycle. And sadly, something that we often see as well is that from the medical side of things, after 3 to 6 months, they're told, well, you should be healed by now, so you shouldn't still be in pain. It must all, quote, be in your head. So something we see often, but Dr. Maggie, tell us a bit about chronic pain and frame it within the work that you do with your patients.
Yeah, I have chronic pain. I had chronic pain. I am currently 54. And at the age of 36, for me, my whole world came down. And it's the culmination of some of the things you're talking about. I had a lot of mental health, depression, anxiety, ADD, brain fog symptoms. I went into early menopause with hormonal collapse at the age of 36. And I discovered around 38 that I had hidden autoimmune disease that no one really gave a rat's ass about. And it was also at that time the beginning of the peak of my struggle with chronic pain. I developed chronic TMJ, wrist, hand pain, and a lot of low back, upper back pain, and some severe headaches. Along with that, with 2 motor vehicle accidents, which I got the same thing after 6 months to a year of that. It was like, you should be better. Well, except I wasn't. And 18 months later, I ended up having 2 neck surgeries as a result. And it really raises the question for me is when medical doctors tell people you should be better by now, it assumes a couple things. It assumes, number one, what we're doing medically as doctors truly actually heal the source of chronic pain, which it does not. And then number two, why do certain individuals heal better than others? And there's absolutely a subset of individuals that don't heal once they get into a cycle of chronic pain. They don't heal. They stay the same or get worse over time. And so there are different populations that we're treating. And when we're talking about chronic pain, we're talking about the group of individuals that should have gotten better, number one. And number two, they didn't get better and in fact have turned into a chronic pain syndrome where it's beyond the 3 months, beyond the 6 months, beyond a year, beyond 10 years, and they're still having pain. And for me, that excites me because I had to figure out what caused my chronic pain, get to the bottom of it. How do we actually break a pattern like this? You know, what's the cause of this pattern? How do we break it? Is there hope and is there a way to turn it around? Those are the deeper questions I love because it intersects with my work, working with patients with hormonal imbalance, food sensitivities, autoimmune disease. And when we have this intersection of these 3 things, this is the population of people with chronic pain. There's an underlying hormonal imbalance, there's digestive and food issues, and sure enough, there's most likely also an immune system component to people having chronic pain. So this is why I practice in the area that I do in those in that space. And I would say 50 to 80% of the individuals I work with have chronic pain of some sort. And that included myself. And so a topic near and dear to my heart.
Okay. And so interesting, because those kind of three components that you mentioned also tie into sometimes the individuals who don't heal in the customary healing time. The psychological factors that exist are often fueled by those same problems that you described.
Yeah.
So it's really interesting, because it's so defeating for individuals who are told by medical doctors that they should be better by now. And I think that in turn exacerbates the psychological symptoms, the hopelessness, the helplessness, and then can worsen the pain. So it's such a terrible cycle they find themselves in.
Well, I think that you put a nail on the head on that right there. What it is I think that I know that for people with chronic pain, one of the most important precursors of that is the loss of self-confidence and certainty. And when we are the ones experiencing the symptom ourselves, we know, I mean, that is data. Your body's giving you data, right? We know what's true with that. But when we express it to the external world, I mean, I feel like there is so much medical gaslighting going on with that, where it's like, first of all, many of these individuals don't even, I mean, hearts of hearts, all of you guys out there with chronic pain, think about this. In all the years you've dealt with it, do you truly know what's the underlying cause, right? And does your doctors know the underlying cause? And much of the time when I'm dealing with the chronic pain population, the real cause is unknown, meaning that, oh, yes, I have the motor vehicle accident 2 years ago, but it doesn't explain why, I still have this pain, or I have this other new pain or that pain. So it to me is very, there's a lack of validation for people for what they're experiencing. Because if the medical industry, if the medical doctors can't identify what's really causing it, then it must be in your head. It's not real, or you should have gotten better by now. So that whole thing plays into a mental, like a neurological pattern where you're being dismissed. You're not being acknowledged. You're not being validated. So the level of certainty and confidence people have around these symptoms that are debilitating becomes lower and lower and lower. You're literally breaking people down. So it is a pattern.
Yeah. So to that point, and to touch on something you mentioned earlier about the medical gaslighting, oftentimes what we find is that these individuals are then given the label of fibromyalgia, even though it doesn't necessarily fit or it wasn't thoroughly assessed.
Yeah.
What are your thoughts around that?
Well, no, I remember, when I came out of training in the 1990s, fibromyalgia was considered we call a trash can diagnosis. Meaning that if someone has pain and there's no other explanation for it, which, is a really large group of people we're dealing with, you press around a couple things and you say, boom, they have fibromyalgia. And we all, as GPs, general practitioners, family practitioners, knew that when someone was diagnosed with fibromyalgia, most of it was likely in their head, because there's no specific one source, one good explanation for their pain. That's all over the body. Fibromyalgia as a term came for pain, someone who has pain all over the body that's otherwise unexplained. So think about how many of people will fall into that. And so it became, yes, a diagnosis. And for people, it was helpful to have the name to it, but the doctors still didn't know what caused it, right? And I know, and we know now that I'll give you guys a definition of fibromyalgia you probably have not heard anywhere else, because I have dealt with fibromyalgia myself and thousands of people. Fibromyalgia really is a group of autoimmune diseases where there's an attack against what we call mixed connective tissue disorder. Mixed connective tissue disorder. Connective tissue is all over your body. It's partly skin, but it's also in your muscles, in your fascia, in your tendons, right? And there are literally thousands and thousands of targets in those areas that people with autoimmune disease, their immune system mistakes as a germ, and it's actively attacking. So what I'm seeing is that tons of these people in the 90s and 2000s that we've labeled as fibromyalgia are more and more showing up later in life with more and more autoimmune disease and diagnoses. And so where we're able to say, oh, there is one target that we can identify that they have an immune disorder that's attacking that area. They have rheumatoid arthritis. They have an autoimmune attack against the bone, let's say. Oh, they have Crohn's, autoimmune attack against the intestines. Well, both of these are actually in the family where it's actually the connective tissue in the body that's getting under attack. Right. So these people don't just have Crohn's. These people don't just have rheumatoid arthritis. They typically also have fibromyalgia, which are other targets of connective tissue that the immune system also likes to attack. So what is fibromyalgia? Is it really a junk trash term? It was. What is really fibromyalgia is a list of different types of autoimmune disorders. And there are other groups in there, but it's a majority of people with fibromyalgia actually have an autoimmune attack against their muscles, joints, fascia, some area that's some target that's all throughout their body. And it shows up as chronic pain in different joints, pain points around the body. And so for me, the role of autoimmunity in chronic pain cannot be underscored. It's a big deal. And there's a huge diagnostic problem, which we can go into later if you want to. But I would, in my estimation, over 98% of autoimmune diseases, we don't even have the blood work or the X-ray ability to diagnose it. So these people are just labeled fibromyalgia.
And then left to fend for themselves.
Correct. And they're cuckoo for Cocoa Puffs, put on antidepressants. They're put on Cymbalta, gabapentin. They are told to go to therapy. And so there are a lot of layers to this, right? But autoimmunity is certainly one of the underlying issues of chronic pain that is completely missed currently, 98% of the time, in my estimation. So it's really a shame to me. But I have a deeper understanding and appreciation for fibromyalgia. So if any of your audience out there is having fibromyalgia, it's not a basket term. It's not your fault. It is actually a real diagnosis. And the cause is what's your general practitioners and medical schools don't train about. The underlying root cause is you've got an autoimmune issue where your immune system is attacking various connective tissue throughout your body. And that autoimmune attack can be stopped and addressed.
We touched upon this last time we spoke. And so I'm wondering if when I'm hearing this, maybe I'm being overly simplistic, but everything you just described with regard to fibromyalgia, how much of that would you say overlaps with if we had put in long COVID, okay? And how much is different? Because there's a cause, a supposed cause. But anyway, so what would you say about that? Can you kind of connect the two?
You're smart, super smart, smarty pants. I'm just going to say that right now. I love this. There's a role of super infections, meaning that certain types of infections when they infect the cells in your body, they change the look of your cells just slightly enough that your immune system starts to say, you're foreign and I'm going to attack you. Okay. So we know certain types of infections can trigger an autoimmune disease. How do I know that? Is when you look at kids, for example, can kids get strep throat? And when they get strep throat, which for some people it's a super infection, it trigger a syndrome called PANS and PANDAS. I don't know how many, and when you're looking at mental health, developmentally kids, with neurologists with pediatric neurology, you're seeing a lot of these cases, right? Where PANS, PANDAS, right? Kids with that. And there's also a blood disorder a heart disorder called Kawasaki's, where it's an attack against the heart and blood vessels. And these are all autoimmune disorders that's triggered by a kid getting strep throat. Not every kid with strep throat is going to get it, but certain kids with that autoimmune genetics is going to be triggered and it's going to get it. So COVID is very similar. COVID is a super infection, meaning that there's something about it where it actually is not just an ear, nose, or throat or lung thing. It actually attacks your gut. It can attack joints. It can attack the brain, right? This is why, and when it infects it, it's a super virus or super infection. What that means is it likes to incorporate into your cells and slightly change the look of it enough your body starts to attack the hell out of it. And this is why people with long haul develop autoimmune diseases at an alarming rate. So you see someone with COVID and they may or may not get long haul, but then within a year to 2 years, they get diagnosed with an autoimmune disease. They may have never had any, or they may already have some, and that autoimmune disease gets worse, or they have new diagnosis. So the long and short of it is COVID is a super trigger to turn on that gene for people who are already genetically predisposed. They come from autoimmune families. And COVID comes and infects the cells, and it triggers for a lot of those individuals long haul. And when you look at long haul and the list of symptoms associated with it, it's everywhere. You're talking about brain fog, mental health, depression, anxiety, right? You're talking about cardiac, where they're having fast, slow heart rate, mostly fast, blood pressure changes, blood pressure going up and down, right? And they're going back to the emergency room, right? And how does that pair well with the anxiety or brain fog of long haul? Horribly, right? And these people are being dismissed in the ER. They're being dismissed at the cardiology office, right? Talk about exacerbation of mental health disorders, right? And then for me, really importantly, COVID also attacks two other targets that is really critical that pulls this in together. COVID loves to attack the gut. So it really impacts on your ability to digest and break down food. And then as a result, it raises a lot of allergy symptoms, food allergy symptoms. So people start reacting to food and they raise what we call histamine levels. And histamine levels causes all sorts of allergic thing. And then they start having bloating, gas, diarrhea, and they think they're going cuckoo. But the problem is elevated histamines impact brain hormones like dopamine, serotonin, norepinephrine, epinephrine, right? So we have this whole now gut infection with COVID causing mental health symptoms, right? And so, when you're talking, and then lastly, COVID will shut down hormone production in many of the hormone making cells for 3 to 18 months because I work with people with hormones and I actually test them. So then what does suddenly putting a woman less in hormones and shutting it down, putting her into early menopause-like symptoms, right? When she's 23, what would that do to a person with irritability, ADD, anxiety, right? So COVID has been a major, major trigger over the last 3 years for people with autoimmune disorders, mental health, chronic pain, as well as the rise of food allergies, food intolerances, histamine issues, and major hormonal health in men, women, and children as a result. So this is the confluence of all those factors I talked about. And that's why also long haul people have chronic pain.
Yeah. Okay. And I mean, whether it's fibromyalgia, whether it's long haul COVID, I mean, I don't know how anyone could not, predict that someone going through all this, would experience one of the more common symptoms that we see that's easiest to identify is fatigue. Everyone just outright fatigue. So I know what we try to talk with people about, but what would if someone said to you, I'm just exhausted all the time. I can't do, everything I want to do, which of course exacerbates the mental health issues as well. What do you tell them as far as fatigue? I have no energy. I can't do anything.
Well, I'm going to link it first to COVID, and then we're going to talk about general chronic fatigue. The reason why people with COVID and post-COVID and long haul COVID develop chronic fatigue syndrome is because COVID loves to attack the mitochondria. And the mitochondria is the energy-making cells in your entire body, including your brain. So no wonder the number one symptom of COVID and long haul is chronic fatigue syndrome. So it's really important with early understanding when you get COVID is you got to really support the mitochondria. So supplementation that really supports some of the cofactors that help the mitochondria make energy is going to be really important. So example, like in our shop, the supplement that I recommend is Mito Recovery. And Mito Recovery has everything that's needed to actually fuel mitochondria, because that is the major target of the attack on the COVID virus, right? Now, when we talk about chronic fatigue generally, it's becoming a modern plague and epidemic. But the underlying root cause of chronic fatigue, I'm going to tell you guys, okay, the number one root cause, like when you start going deeper and deeper down, and I say root for a reason, this is the real problem, is digestion. So digestion is one of those modern, it's the devil you don't know that has been there since birth for a lot of people, but over time, it just keeps layering on and getting worse and worse. And because if you think about what digestion is there to break down food from bigger pieces to little pieces, all the nutrients, and it's there so that when it's broken down really small, your body absorbs it, incorporates it, start to utilize it throughout your entire body, right? But the problem is our ability to digest and absorb gets worse and worse over time. And so the problem is that we have like, when you think about kids, babies, and those of you in the audience with kids, think about it and your own history. How many of you have chronic fatigue or have had a history of when you were a baby, you had colic? There was an intolerance to certain formulas, right? Or you were a really finicky kid who didn't like to eat a lot of this food, that food, a lot of food aversions, or you had eczema or asthma, or you had tummy aches and nausea all the time. These are all signs of digestive disorders in children we ignore. And your pediatrician and GI docs have no training around it. And then you go into the doctor, and it's so fascinating is that we started when these medications came online, like Zantac, Pepcid, Tagamet, these are, Prilosec, Nexium. We were using them because we said there was too much acid. And we even started to give babies in the ICU these types of medications. And we wonder why there's such a rise in food allergies going on and mental health disorders later on as a result of it. So we've misunderstood digestive disorders. We started to treat them with medications that shut off more steps in digestion. And then later in life, we developed things like do you know COVID, I mentioned, infects the gut. So what happens when you have these super viruses like, COVID or Candida or Lyme, people get Lyme, and they infect the gut cells. Well, they break down more digestion steps. So what happens is over time, more and more steps in digestion gets broken down. And then as a result, we have a broken system that to break down, incorporate, and utilize the vitamins, nutrients, and food that we're eating. We've completely broken that down, not even to even say what happened to all the food over our lifetime has happened to food. Right. So the inability to really digest food and break down food has given a rise to severe food allergies and sensitivities, severe malabsorptions of the food that we're eating. And then number 3, there's been changes in the quality of the food that we're eating that really have changed the nutrient content of it. So as a result, people are now developing lifelong chronic fatigue syndrome because they're very, very low in these vitamins, nutrients that are needed and critical for brain function, for physical body function. So the root of this problem is digestion related, but nobody's out there fixing digestion. And that's why in my book, the first chapter that's medical in my book is, digestion, the first domino. And I'll give you an example. I had a guy, Jason, I met at a conference. And Jason came to me and he said, he just met me at the conference and he said, hey, I have chronic fatigue and I have severe ADD and I got this horrible heartburn. And he's sitting here chewing a roll of Tums. And I said, hey, Jason, if there's nothing else that you do, read the first chapter. But in our store, there's a supplement called Digested. And just for shits and giggles, take Digested, 1 with small meals, 2 with big meals, and thank me later. And Jason has written a review in Google, and he has never done any other programs with me or anything. He's only taken that supplement. And the reason I love it is because we formulated a supplement that actually, addresses every single step of digestion. So you don't have to even know which step is broken. You take something that with minimal number of ingredients that actually addresses every step. And he's lost 65 pounds. His chronic fatigue is gone. His heartburn is gone, and his ADD is gone. And that's how powerful digestion can be. And so I know this is about chronic fatigue, but I really wanted to give your listeners like a really big takeaway from it is digestion is the reason and underlying very first root cause for chronic fatigue, and it starts in infancy.
So yes, we're talking about chronic fatigue and chronic pain, but I'm so fascinated. I have like 1,000 different thoughts. I'm trying to narrow down what to focus on here, but I wonder how much of it is a chicken or the egg situation or just a paradigm thing, because in our work, we're looking at, gut health regularly when it comes to psychological distress and psychological functioning. We know that GI upset is something that's very common with anxiety and with depression.
Don't ignore it.
So oftentimes we will, for example, have a dietitian review their diet and give some recommendations surrounding that. But is one causing the other? Are they interrelated? Can you talk a little bit more about that relationship as far as like which is coming first?
When you say what's first, you mean
the psychological distress or the GI upset, or
it starts with the GI. It really does start with the GI. Because that's I think, thank you for that point. There's a big gut brain connection, and I want to simplify it for everybody, which is like, I love what you just said, Malini, about how, when you see someone with anxiety, ADD, autism spectrum, bipolar, whatever the diagnosis is, you got to get really curious and ask questions about what's happened with the gut, not only the current symptom, but their past symptoms and also their family history. And the reason being is there's a genetic component to this. And like I said, when you go back far enough, there's usually a history, even when they're a baby, of some of this. And so it for me, the chicken or the egg, the chicken clearly is digestion to me, meaning that we are missing signs from infancy that these digestion issues are a problem. And secondly, there's a genetic component to this, meaning, like, let me give you an example. The Hispanic population, as a tribe, as a genetic group of people, have a very high rate of poor fat digestion in their genetic gene pool. And this is why when you go into any Hispanic family and you ask how many women in their mid 40s to 50s got their gallbladder removed, you can be like 50% or something. And to me, it's like, nailed it, called it, is how I always do that, because I know there's a genetic basis. And you can see it in certain like tribes of people from similar genetic gene pool. You see it in families. And that's why, like, when you are sitting here, you're asking the person like, oh, do you have anxiety? And then you ask them like, do you have just any sort of gut related symptom? The answer to it is pretty high, but you'd be surprised how many people that says no to you when you actually ask them, well, let's go back to your mom or dad or brothers and sisters or your children. Boom, it lights up like a Christmas tree. Okay. And the thing is important is that it is not the same manifestation in every generation. It shows up differently, even though they have the genetic background or gene pool, right? In each individual, it can show up differently, meaning in one child, it can show up as, like severe, like nausea, vomiting, and not going to school, missing school, anxiety, right? In another kid, it can show up as eczema on their skin. Right? And in another kid, shows up as none of those symptoms, but the kid has ADD. And they're all related to digestive disorders. So the chicken has to be digestion, which is for me why, it's interesting. I focus a lot of my work on digestion, whether it's on, when we have a food mapping program where we actually go and identify food allergies, but we don't just do that. Like for me, hand in hand has to be, what is the digestive issues? Because it's really hard for the parent or the individual to sit here and say, okay, these symptoms are all related to food I'm ingesting. Let's meet with a dietitian or nutritionist. That's going to solve the problem. And it doesn't, because 50% of those reactions and symptoms are related to digestion. So don't we need to address both in order to say, and do the testing to figure out what the food sensitivity and allergies are, but also educate on every step of digestion and working with the individual to say, oh, these symptoms are related to digestion, and then tease the two apart so we can address both. You have to address the chicken and the egg. And so that's where sometimes just sending someone to a dietitian or nutritionist doesn't solve the problem, because there is underlying food allergies that's involved that needs to be accurately identified with data. And there is digestive issues involved where I would hope a really good functional dietitian, nutritionist is also going to say, some of these symptoms might be digestive. Let's get you on a multiphasic digestive enzyme and product that supports every step of this so we don't miss the boat on that piece of it. Has to be addressed both. Definitely digestion is a chicken, but then the egg comes with the food that we eat, food allergies that we get, and the medications and things that shut it down and infections that shut it down. So we got to address all of those.
So whether it's with psychological disorders, chronic pain, chronic fatigue, at what stage should somebody start investigating digestion? Is there like
every age,
an amount of time? No,
every
stage.
Age.
So stage in their recovery.
Yeah, the sooner the better.
Mm-hmm.
Because here's the thing, like I work with a lot of kids on the spectrum, and we work with a lot of kids with mental health disorders, right? And a lot of times, we jump on, and we should, on how poor the diet is for these individuals. And that's great. We're getting them to eat, less processed food, more real food, all that, right? But the single biggest thing that moves the needle for these individuals is the first thing I do, and I treat a lot of mental health, right? The first thing I do is I'm like, whether it's a kid or an adult, I say, can you get on digested? And that's why we have a digestive chewable, we have a digestive capsule, because the first thing I do with kids, whether if the kid can chew, they're going to be getting on my digested chewable, and it tastes good. And the thing is, you could see results immediately, whether it's on pain, whether it's on autism spectrum, ADD, it's pretty immediate. Addressing digestion is one of the fastest levers to mental health improvements and chronic pain improvements. Since we're talking about chronic pain, I'm going to circle back to that. Okay. But the number one thing dietary wise that you can do to support mental health is to start with like digested chewable or digested. One with small meals, two with big meals, and that will attack all the different steps that are broken in digestion, because the gut is going to trigger a lot of mental health symptoms. And I'm going to link that together for you guys. So in the gut makes serotonin, right? The gut makes histamines. So it's not just your brain that actually makes these brain neurotransmitters, brain hormones. Your gut does too. And there's other hormone making organs like the adrenals that also make some of these brain hormones like norepinephrine, epinephrine as well. So it's not just the brain that's involved in making brain hormones and brain neurotransmitters. The gut also makes histamines. Histamine doesn't just cause allergies. Histamines is a brain neurotransmitter as well, and it impacts on the level of norepinephrine, epinephrine, and serotonin, all of which are involved with depression, anxiety, and chronic pain. So when we look at chronic pain disorders, it involves serotonin, it involves norepinephrine, epinephrine, it involves the amount of histamines, glutamine. Like there's all these gut-related type of hormones and neurotransmitters that are made that directly impact on the brain, and it impacts on the production of these hormones in the brain as well. So big connection between gut and brain right here. And that's why I'm saying, hey, I'm here to like raise the alarm bell to say digestion needs to be addressed immediately as a first step, and the sooner the better.
So what if somebody, again, as Melanie said, we have many clients who were in motor vehicle accidents or injured, through WSIB. So what if they say, you know what, my family, we have none of these histories, and I was in an accident, my lower back kills me, so now I can't work out, I can't sit at the computer for more than 10 minutes, blah blah. So if they say they say, and I'm still in chronic pain. So if they say, how is my digestion going to help in this regard? It's purely my back. That's it. You can't tell me otherwise. What do you say? I have
a really simple answer. Okay. Pain, one of the most important, one of the things that causes chronic pain is actually what we call histamine levels.
Right.
So pain is not just pain in that area. They're actually neurotransmitters. They're like substance P. They're all these chemicals in your body that contributes to chronic pain. And so what we find is when an individual have chronic pain, the levels of what we call histamines are really elevated. And that affects brain and the gut and muscles. Okay. So the number one way with which you can reduce histamine is to help digest your food better.
Right.
So if you lower histamine at the intake, right when you have food coming in and you lower the histamine, within a matter of 2 days to 2 weeks, the histamine level in the muscle and joints are going to go down, and people notice a difference in their pain, number one. But the other second thing of this is certain foods we know cause pain, right? And food allergies are going to be part of this. And so some individuals will even say, and gluten is very high on that list because it's the biggest trigger of autoimmune attack. So if nothing else, someone says, my back hurts, I can't do anything, whatever, it hurts. And how does digestion to do with it? I just said, we got to lower your histamines. Take, for shits and giggles, you're going to be taking all these drugs anyway, and nothing is helping anyway. Humor my ass, right? Take the digestive support. Okay. It's natural. It's not going to cause you to have erectile dysfunction like some of these medications are going to. It's not going to have a side effect. It's not going to constipate you. Humor me, right? And a lot of these individuals are on drugs that's going to constipate them and shut down their digestion anyway. If nothing else, say, you know what? You're taking this opioid medication. Oh, you know what? You're taking gabapentin. All these things are going to cause them to have some GI symptoms anyway, to say, you know what? Just take the digestive support to counteract the side effects of the medications you're taking and just see what happens, right? If nothing else, to say there's GI effects of the drugs they're taking, why not take something digestion to promote regular digestion to balance that, see what happens, right? And that would be my short answer to it. And the second piece to it is some people will really say, what is one dietary change that I can make to decrease chronic pain? And if nothing else, is to go gluten-free. And the only main reason for that is I would say about 60% of individuals have a gluten intolerance. And gluten is the most inflammatory. If you are one of the 60% of individuals that have a problem with it, it is one of the worst triggers of chronic continuation of chronic pain. The reason you're not healing from chronic pain is because there's an extremely high likelihood you're part of that 60% that have gluten intolerance. And you can't, it's really difficult to identify gluten intolerance. We do many of the ways with which we do that. You can help identify individuals. But at the end of the day, if you have chronic pain, the number one food that likely is contributing to your chronic pain is because your body's really reacting to gluten. So go gluten-free. Okay, go completely 100% gluten-free for 3 months. Humor my ass because your pain has been more than that. And, and that's one dietary change. But I have seen between digestion is the quickest lever. The second quickest lever is to say, go completely gluten-free, because within a matter of 6 weeks, that 60% of group that has the chronic pain with the likelihood that they respond to a gluten-free diet is like 80%. So the best treatment that we have for chronic pain has a success rate of like 30%. Why wouldn't you do something that has like an 80% rate of improvement for you?
Yeah. So as far as making changes, like I know that, again, in our practice and what we see, there's a lot of, I don't want to say resistance, because I think people ultimately just want to get well, but like making big changes like that can often be hard. So what do you suggest as far as like getting started with eliminating gluten?
Yeah, I would say it's not for everybody, meaning like sometimes people need really high leverage, meaning like it's interesting how many individuals, including myself, have to hit a certain point of rock bottom to say, well, there's nothing else that's really worked. And then there's leverage, or there's an urgency related with how bad the problem really is, to the point where, like for me, my pain was like, it was so long and so bad and so hard that, people really start to think, is life really worth living? It's so hard to live every day. So for me, like when I'm talking chronic pain, I get the 10 out of 10 for 10 years, right? So for me, when the leverage is that high, going gluten-free by comparison pales.
Yeah. Yeah.
Right? When you really put it like that, right? So for me, like that comparison, like that, the weight, the why becomes super highly valuable. Like, so, but that's a mindset shift on, wow, like this 10 years, 10 out of 10 pain. And I just have to go gluten-free for the next 3 months to see if this helps, right? Like that, the leverage there becomes really like a no-brainer, right? And when that happens, where you realize just, like it's a choice. I just have to make a choice. But until you're ready to make that choice, it's hard. But when you have a mindset shift where you're like, well, nothing's worth 10 out of 10 for 10 years. This is easy and pales by comparison. There becomes a shift from fear to excitement.
Mm-hmm.
I get kind of,
there's hope that comes with it,
because it's like, what if there's an 80% chance this is going to like decrease your pain, like over the next 3 months, even by 10%, 20%, 30%, 50%, like, is it worth it? Is it worth it? Because I have individuals who say to me, I've tried everything. No, you haven't. You're convinced that you've tried everything. Your doctors are convinced that they've tried everything, but no, you haven't. Right? So once you just realize that I just need to make the decision to do it, and I'm going to use that fear or overwhelm, I'm going to turn it into excitement. Because you're telling me that you want to find the answer to how to solve chronic pain. I just gave you one, and it's a damn good one. I would think that being able to turn that into excitement, to be like, I finally heard something where real people are getting these kind of results. Me, I did, right? And I help thousands of people do that every year, right? It works, right? But it is not, you're never going to get that answer from the doctors. And I am a doctor. I didn't get that answer from my doctors. So, because there's no money to be made in that, right? So when you're ready to jump off that money train of the medical industry and pharmaceutical companies that tell you it's this drug is that drug, and you want the real answer and you get excited around it, it becomes so much easier. And for me, like, any diet change, whether it's going gluten-free or deciding you need to go, vegan, or deciding that you don't want to do dairy anymore, it comes first from a place of decision and the commitment. So make the decision, right? And when you make that commitment, then choose excitement to say, I'm going to take this on as a project. Meaning, like, you've been in the 10 years, 10 out of 10 pain project for 10 years. So this is a new project. You're going to learn more about food. You're going to learn more about, like, let's say you pick the topic of I'm going to go gluten-free. Get curious, get excited. And there's so many resources. Do you know you can go into ChatGPT and say, you know what? Give me, a week worth of meal planning that's gluten-free, dairy-free, and under 1,500 calories per day, utilizing, a pantry that is a college student's pantry or something. Like, you could put all sorts of things into this that makes it so easy. And one of the things we teach in our program is how to use and leverage AI as well. You can literally go to ChatGPT and say, give me a gluten-free meal plan for a week. And I would like a shopping list at my local grocery store that's going to give me $300 worth. I want to spend $300 worth of groceries a week. You can do it that specifically to make it easier. But it requires your commitment and a will and an excitement towards it. If you're not excited, you're not committed, none of those resources matter.
Yeah. And I guess what I'll add to that too is that, sometimes with chronic pain comes feeling defeated, feeling hopeless, helpless. So I think part of the challenge is the motivation to make those big changes and find those tools. But once that can be worked on, I think you're right that there's so many great ways to get started.
I think it's the people around you, right? They're working. Yeah, go ahead.
I was just going to say that just in defense of many of the people that I've worked with who have that chronic pain, and you're talking about people around them where a new suggestion does come, and it's so hard for them to generate that excitement, even though everyone else is like, why can't you come on, it's just do this thing? Because they say, because I've tried everything else, and if this fails, then that means I have no hope, because they're pinning it all, and this is my last chance. So I understand how it's hard to generate that excitement when they think, because again, if this fails, what hope do I have? I've lost all hope then.
That's the problem right there, because if this fails, meaning that they want this to be the one trick pony.
Right.
Okay. Yeah. And you're right. When we're dealing with chronic pain and depression, people are hinging so much on the pill or the one solution, whether it's a medication or it's a green supplement or it's one dietary change. It's not about that one thing. It's, to me, really important to these people is working with individuals and providers like you, like me. And because what we provide is a, professional support for this. I mean, I think the people that you guys treat are damn lucky. The people that get to work with providers like us are really lucky. And it's not luck, it's a decision and a commitment. Because to me, this mission and this journey has to be led by professionals who know what the hell they're doing and are able to provide you the support, continue next step on this journey, because it's not a one-trick pony. And one of the things I do in our programs is we do this in a small community setting, because people feel so alone in this chronic health and mental health journey, and they are not. I can tell you right now, of all the people that are listening to this podcast right now, you feel like you're alone. You're some super special rare zebra. And I can tell you 100% confidence, you're not. You're not. I wasn't. There are millions of Dr. Maggies around with the health symptoms and syndromes that I have. You know why? I've talked to them. I've talked to thousands of them every year, right? So whatever you've got, there are hundreds of thousands of people also suffering with this as well. And when you get into for me, I like to work with people, not just individually, but in groups, small groups as well, where they get the data, they learn together, and they troubleshoot together with me. Like, education and wisdom has to be the way out of it. Here's the problem. A lot of people and practitioners also listen to this and they say, I need to gain the knowledge, right? And now with the age of AI, I can go to ChatGPT and type in the answer. And it's not knowledge that's going to take people out of chronic pain. You know what it is? It's wisdom. And wisdom is hard gained, hard earned For those of us who have been gaining it, our wisdom rings and halos around us, hard earned, took a lot of work. But individuals who choose to work with us can take advantage of our wisdom rings to fast track it, right? So for me, like, it's really important for individuals like to align themselves, find practitioners who are like you guys, like me, who's willing to work with them and take them through this journey. So it doesn't have to be your last hope. For me, like, it's like when I work with people on hormones, some people think the question is, should I get on hormone prescription or not? And I'm like, holy hell, the answer has about 100 other tools in that. Let me come at me, bro. Like, like for a lot of men, it's like, oh, is the solution getting on testosterone? I'm like, no. And maybe yes. But the thing is, there's like 100 other tools with which we can go at this, where there's like so many answers and not just one. Yeah. So it doesn't have to be your last hope, but find practitioners who are curious, who are open, who are excited themselves, who's going to lead you so you can partner with people who can help take you along on that journey, because it isn't going to be a one-trick wonder, whether it's medication, a supplement, or one dietary change.
Absolutely. Yeah. And I think that's a great place for us to leave it off, to leave something for our listeners to reflect on as far as what they can do, right? Sometimes it feels hopeless, but it's not. There are ways out. There's alternative ways to look at it, and having that proper support, I think, is key.
I 100% agree. And so who are the people around you, but really importantly, who are the practitioners that are around you? Mm-hmm. And please, 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 I have a message for your listeners is don't limit yourself to the limits of the traditional warehouse medicine model. The answers do not lay in traditional going to the doctor that your insurance covers to get a prescription, a referral, or a procedure. That's not the answer to chronic pain. It really isn't. It may be, and I'm talking chronic intractable pain, right? And if you have, and those are good from what we call acute problems. If you broke an arm, go see a doctor.
Absolutely. Yeah.
Right? I mean, yeah. But
there's a time and a place for the medical model.
But at the point where it becomes chronic pain, chronic depression, chronic anxiety, you got to look outside the box. And it's a good segue. I'm going to give your listeners a copy of my book, 8 Out of the Box Ways to Transform Your Health. And the reason, and it's going to be in the show notes. To me, one of the most important lessons I learned from my chronic pain journey is get outside the box and get different people around you. Get yourself curious and excited. And if you can't, find curious and excited people to work with. And get my book download my book for free, get a copy of my book. You're in Canada. A lot of you guys, there's a free download for my book that we're going to provide in the show notes for you.
Awesome.
And that encapsulates some of the 8 top lessons I learned on my chronic pain journey.
Okay. Well, we appreciate that. And thank you so much for being with us today again, Dr. Maggie.
It's been a blast. Thank you so much.
Okay. Well, and on that note, until next time, keep your eyes on the road and your hands upon the wheel.
Boom.